A popular new stop smoking pill from the world's biggest drug company is in the midst of a safety controversy.
It is a complicated situation with a lot at stake, especially for Pfizer. Here with the company's response is Dr. Ponni, the Vice President of Medical Affairs. Dr. Subbiah, thanks for being with us this morning.
Good morning.
So what do you think is at stake here, or at work, I should say? The FDA came out saying for the first time a couple of weeks ago that there is possibly a cause and effect between the drug and the neuropsychiatric side effects, but you and your colleagues at Pfizer remain unconvinced of that. Why?
Well, I think first it's important to step back and realize that smoking by itself is a complex process and is actually a serious medical condition. And smoking, when you get to the smoking cessation area with or without drug, it has further complexity because when a person tries to quit smoking, they do experience nicotine withdrawal symptoms. Now, these symptoms include depression, irritability, depressed mood. So sometimes they can overlap with some of the symptoms now that's being reported in sports marketing events with Chantix. And that's why it's important to keep in mind the information that we put on the label is based on evidence. And the data to date suggests there is not a causal association based on the data that we have available, but at the same time, in some reports, a causal association could not be completely excluded.
So are you saying that this could be the result of nicotine withdrawal, that a lot of people who are going through nicotine withdrawal do try to kill themselves or do kill themselves?
No, I think it's important to keep in mind now that the label has actually been updated with neuropsychiatric symptoms, which includes depressed mood and suicidal ideation. Now, it's important to keep in mind now that if a patient is trying to attempt to quit smoking, that it should be done in a conversation with the doctor. And that's why we do feel that working closely with FDA, that the fact that we have put it in the warning section, what we're hoping is by doing this, that the patients will go and have that dialogue with the doctor and make sure that this is something that they want to do, and that Chantix, which we feel is a breakthrough product, will be considered as one of the options.
Doctor, I know that I had seen certain SSRIs, and that's a class of antidepressants like Prozac and many, many others, that some were suitable maybe for smoking cessation, but this is not. What is this? Where does this? Where's the action? Where is it mediated with this drug?
Yeah, so it is actually a very, very interesting mechanism of action. It actually works. It's not a nicotine replacement, but basically it works at the actual receptor where nicotine acts at. It acts like a shield, and therefore it prevents nicotine from acting there, and so therefore it prevents the reward effect that encourages the smoker to continue to smoke.
Okay, so there are nicotininergic receptors in the brain then. That's what you're telling me. Okay,
yes.
So it has nothing to do with serotonin.
No, it's an absolutely
Subbiah?
different mechanism. Yes.
Dr. Subbiah, I think the FDA, Derek says in his really well-written story here, it cites 34 suicides and 420 instances of suicide behavior. Now, that's in 5 million prescriptions. So if we took a group of 5 million Americans, just regular Americans, not on any drug, how many suicides among 5 million would there be in the time the drug's been on the market?
You know, that's actually a very interesting question, and actually one of the things that's very challenging in this area is there is not much research in the actual area of suicide and neuropsychiatric adverse events in the area of smoking cessation. And so, but when you step back and look at the nature of the problem now, in the world there's over 1.3 billion smokers. Now, in the U.S. itself, over 500,000 deaths occur annually due to smoking. And so it is very important to keep in mind right now that over 5 million patients are right now on Chantix. Many have benefited from the drug, but with any prescription medicines, there's a risk-benefit dialogue that needs to occur between the patient and the physician. And when this occurs, research has shown when there is a dialogue and the doctor is closely working with the patient at the end of the day is going to be more likely to quit smoking.
Okay, Dr. Ponni, we really have to let you go at this point. So thank you again for coming in this morning.